What's up, beautiful people, and welcome to the Every Woman podcast. I'm your host for today, Paige Monet. And remember, this isn't just a show, it's the group chat you didn't know you needed. And today, we're making podcast history with our very first episode. We're diving headfirst into Women's Health Month, and I've got a powerhouse guest to help us do it the right way, Dr. Velma Scantlebury, the first Black woman transplant surgeon in the country. Yes, she's a history maker, and we love to see it. She's also the co-founder of Delaware Health Equity Coalition. She has been named to both the Best Doctors in America and Top Doctors in America list multiple times. Dr. Scantlebury has earned her medical degree from Columbia University in New York City. She has performed over 2,000 surgeries and has over 1,800 books sold of her biography, Beyond Every Wall. Dr. Scantlebury is here to school us, inspire us, and give us the real on taking care of our bodies, our minds, and everything in between. So whether you're on the move, on your couch, or just here for a little inspiration, turn it up, tap in, share with your friends, and let's get into it. Welcome, Dr. Scantlebury. How are you?
I am great. Thank you so much for having me here today.
Of course. So, Dr. Scantlebury, we know you've made history, but before we get into all of that, can you tell us who you are when you clock out and you're not in your white coat?
Well, I am, when I'm not in my white coat, I am a wife and a mom, and so I love to cook, and I love to read, and I love to walk and exercise. So I try to get those things in, not as often as I would like to, but I also like to educate. So I'm always reaching out, or people are always reaching out to me to get opinions or treatment recommendations. So I'm always on the clock when it seems like that, when it comes to being a medical doctor.
I can imagine you're a very busy woman. So what inspired you to pursue medicine, and not just medicine, but surgery, in a space where there are not that many women, especially Black women?
Well, I have to say that before I got to medical school, I sort of envisioned myself as maybe a pediatrician or taking care of a regular doctor. But then I got to medical school, and I was totally in awe of anatomy. And the gross anatomy class just did it for me. I just love dissecting, knowing different parts of the body. And so from the very first month of medical school, first year of medical school, I realized that I wanted to be a doctor, but a surgeon especially. And met my first female surgeon, who was a pediatric surgeon, during my medical school third year, and I wanted to be just like her. So my goal in life was to become a pediatric surgeon and come back to Harlem Hospital and take over her job.
Oh, wow.
But somewhere along the line, I got involved in transplant, and I got swayed over to transplant surgery.
That's amazing. Okay, so let's dive into women's health. So what are some of the biggest misconceptions about women's health that you wish more people understood?
You know, the thing about women is that we tend to ignore our symptoms and our own health, because oftentimes we're very busy and we're involved in so many different things that what we neglect to do is to prioritize our own health and well-being. Whether you're a wife, whether you're a mom, whether you're an aunt, whether you're a CEO, whether you're a bus driver, there's always things to do, and we tend to always be multitasking.
It's so true.
And many of us go to bed with things in our mind that we want. Oh, I forgot to do this. Or I have to do this in the morning. And we're making checklists in our head all night long, and with a list. And so we're constantly doing that, and we put ourselves back on the burner and not really addressing our needs. And so, emphasizing Women's Health Month is really to encourage women to understand that you need to put yourself first. And we tell other people that, but even for myself, I need to listen to myself and realize that there's a whole lot that I could be doing better. And with that reminder, it just sort of helps us to understand that, when was the last time you had a good conversation with your doctor? Are you exercising regularly? We all don't have time to go to the gym, or you don't have time. We're busy. And every time I drive by a McDonald's or a Chick-fil-A, I say, oh, these people in line.
I know.
I know it's quick and it's fast, but how often are you doing? Not to say that you can't do it, just have to limit the times that you decide that, this is oh, I just have to get
Definitely.
there. I
Yep.
don't have time to go home.
It's true. You definitely have to be mindful of those things. And so, speaking of that, when we say listen to your body, when doctors say that, or when we say that talking to our friends and stuff, what does that actually look like in real life?
Oftentimes we neglect to the fatigue that we have, or the fact that we're feeling really, really stressed, and you're having anxiety over different things that are on your table in terms of all the things you have to do. Or you may be having an indigestion and you think, I must have ate some wrong food. But how do you know it's not a chest pain? Are you
Right. ignoring
that chest pain that you're assuming had to do with those tacos you ate yesterday? And oftentimes there's clues that say, I need a day off. I really feel like I'm run down. I need to take a break. But you get up and you keep going.
Yes.
And you get this nagging feel in the back of your head that says, you need to take a day off.
No, it's
And then
so
before you
true.
know it, you get sick. And your body says, okay, you were not listening to those voices in your head. So
Right.
now I'm going to make you rest. And then you said, oh, I know I should have listened to my inner self.
No, it's so true. And so when we talk about things like listening to our bodies, what are some like preventative care that women should be doing to make sure that no matter what their age is, that their health is going in the right direction, or, having the right levels, whether it be blood pressure, things of that nature? How do we make sure that we're taking care of ourselves, like preventative care that we can do for ourselves?
Absolutely. And, one of the things is realizing that, up until the age of 18, you're probably visiting the pediatrician for one thing or another. But when we talk about health screening for women, over the age of 18 to 20, it's really about making sure if you don't have high blood pressure, but you have a family history, you want to make sure if it's normal, still make sure you get it checked every 3 years or so. But
Right.
for everyone, they should see their doctor every year, at least for a health check, making sure all things are normal, because oftentimes there are diseases such as high blood pressure and diabetes that have very few symptoms.
This is true.
And so you may not notice your blood pressure is high. And so many times in our screening clinics, we see a whole lot of people with high blood pressure over 200 where we're sending to the emergency room.
Wow. That's crazy.
So we want, no symptoms. You may not have a headache. You may not necessarily have palpitations, but it's important. And if you're a female, you want to make sure that you have your screening mammogram at least at age 40. If you do have a family history or strong history of breast cancer, you may want to speak to your doctor about it, such as a mother or sister. Then you may be at higher risk because of genetics, and that may be an indication for an earlier mammogram and or ultrasound.
So that was my next question. So I'm 26, I'm turning 27 this year, and I actually do have a family history of breast cancer. My mom is a breast cancer survivor, and so were a few of my aunts. And sometimes it has me a little bit on edge. I'm trying to figure out, like, when should I get mammograms and things of that nature? What type of checkups and screening should women not skip, and what age should we be getting them if we do have family history of like things like breast cancer and stuff like that?
Well, certainly it's an opportunity to have that information plot out. What age did your mother develop breast cancer, or your aunts? What kind of cancer do they have? And what age did it present? Are you doing your breast self-examinations? Are you finding anything there? Are you seeing a specialist who may be able to make sure, have you looked at any genetic markers that may be there that you could get tested for, especially depending on the type of cancer? So that's a conversation you can have with your physician or your provider, so that they can look at what are your risks based on the age, presentation, the markers, the type of cancer, to decide when would be appropriate for you to then have that mammogram, and at a time that would best be indicated as opposed to starting too early.
Okay, got you. Because I know, like you said, mammograms normally start at 40, but I always have the fear of, like, God forbid something happens, like maybe I should get mammogram earlier. But I definitely understand what you're saying.
Yeah,
It's just
and your doctor will, with a family history, you may need it at 30, you may need it at 35. And so that's why that conversation is important.
Okay, thank you for that. And so, speaking of going to the doctor, there's often fear or avoidance around going to the doctor. What are some ways that we can ease anxiety for some people and have them start seeing healthcare as empowerment instead of fear?
Absolutely. I mean, you need to take care of our outside of our body. We don't think twice about going to get our nails done
Right.
and getting our hair done, getting our eyebrows because we want to look good.
Right.
They want to present present in a good way. And so we need to sort of shift that inside. What's going on with my body on the inside?
Yes.
Am I doing what I can do to the best of my ability to live longer? I mean, certainly you look at your longevity in your family and say, what are your risk factors? What am I eating? Am I putting myself at risk for heart disease when you think about the things that lead there? Am I still smoking? Are there things I can do differently? Because you have to value yourself and take an interest in your own body and say, this is my temple.
Yep, I was going
what
to say
can
that.
I do to make it the best possible temple?
Yep, your body is a temple. And so, speaking of that, what are some daily things women can do to make their healthy lives a little bit easier, like whether it be eating right or what are some tips you can give our audience on how they can manage a healthy lifestyle daily, whether it just be like something simple like eating an apple or drinking water? What are some tips you would like to give our audience?
Absolutely. I mean, certainly, we say 64 ounces of fluid of water is great, but if you can get 48 ounces in and you're only used to drinking 16, then that's a great thing. The more water, our bodies are about 80% water, so you want to make sure we're replenishing ourselves. Then we drink more liquids, especially water. We regulate ourselves. Not only are you flushing out your kidneys, but it puts you in a better position to relieve constipation. You want to get that fiber in. So this is why we say eat an apple a day. Make sure you get your fruit if you're not an apple eater.
Right.
There's strawberries out there. They're berries. The berries are very good for you. And also think about minimizing the carbs and thinking about the protein. Can I ditch, I'm going to eat a hamburger, but maybe I just have the burger and the cheese and lettuce and tomato. And maybe just use the bun to hold the burger, but you're going to tear off of the bread as you eat it.
No, that's true.
And so eat less of the bread.
Right. So water intake, eat your fruits. And then, so for people my age who are, kind of partying and going out, drinking, maybe smoking, what would you say is I know they say you're not really supposed to drink, but what is a healthy intake of if you have a glass of wine or something like that?
Remember, most alcohol has a lot of calories. So you want to make sure, you minimize the calorie, which is why men who drink beer, we said they have a beer gut because it store their fat in the abdomen. Men tend to do that. So you want to be careful, not so much with the calories in the wine, but when we're out, those appetizers are often delicious, but just think about the fat and the calories in them.
So question, you mentioned men having beer bellies. Is that a thing for women too? Can we get a gut from alcohol? How does that work? Or is that just a male thing?
Well, no, it's not a male thing. Women are different shapes. So we become pear-shaped where we carry a lot of our weight in our hips and our, below our waist. And then there are those who are apple and you have more fat around the waistline. And what has been shown is that abdominal fat is more linked to heart disease than anything else.
Wow.
So waistline fat, if you are apple shaped, you want to really work hard to decrease your risk for heart disease because all that abdominal fat puts you at risk because you're storing. So you want to make sure you're checking your cholesterol and, looking at your risk factors. Do you have a history of heart disease in your family or coronary artery disease? Has anybody had bypass surgery or stent? So those are things that are much more important, abdominal waistline and abdominal obesity than overall obesity.
Oh, wow. That's crazy. Okay. Interesting. So speaking of women and the conversation of how surrounding our bodies, can we touch a little bit upon access to care? I know especially for Black women, sometimes there are barriers that have, that keep us away from the doctor because we're scared we won't be heard or overseen.
Absolutely.
So can we talk a little bit about that? How do we as Black and brown women break those barriers and, speak up for ourselves in the doctor's office? What are some things that we should be saying to our doctors to make sure that we are heard and that they are seeing us for whether it's like pain or, just making sure that we are being seen in the doctors?
And I have to say, one of the reasons Delaware Health Equity Coalition exists is because we were hearing during the pandemic as we were vaccinating patients that they really felt ignored. They were not, no one was listening to them. And so they felt like their worth was not there when it comes to being treated by their regular healthcare providers. And so we developed this clinic because we want to give our patients a safe place to be, where we can give them the time. It's not 15 minutes. If you're here for a new visit, we will give you the time you need, whether it's 30, whether it's 40, whether it's 45 or 50 minutes, so that we can really hear you and go over and be there to listen. But it's also important to be able to develop a trust with your healthcare providers, because once you have that trust, you can begin to be better engaged. And so it's often important for that person to understand you, understand where you come from, be able to know that there are certain things that if they have a different background, they have to be culturally sensitive to who you are and your upbringing and, what your values are. And I think being able to have someone not just see you as a number, or you're here for 15 minutes, if they're constantly looking at their watch because you have to be in and out of there, then they're not hearing you.
It's true.
So you want to be, when you go for your office visit, make sure you write the things down that you want to discuss with your doctor. And so you say, when you go in, you say, I have a couple of questions. Do you mind if I start? So you start off with those questions or concerns that you have and have your physician address those and not wait to the end of the visit, because oftentimes they're rushed.
Yep.
And they're like, okay, sorry, but I might have to see you another time.
Well, we thank the Delaware Health Equity Coalition for seeing the women of Delaware and hearing us and, treating everyone as human beings, because that's so important, especially when it comes to healthcare.
Absolutely. Absolutely. And so we want to focus on this month for National Women's Health, being able to highlight women and encouraging them to not think about just their physical health, but mental and emotional well-being is important to also be able to make sure you're taking care of that aspect. I know there's stigma around mental health, but so many of us are in that position where you need some help. And I think about mental health is a deficit of something, just as you're diabetic, there's a deficit of insulin. If you're mental health issues, you could be having a deficit of those good hormones that make you perk up. And so if you need medication, that's okay. If you need counseling, that's okay. Now everyone has a therapist, just about. So don't
be ashamed of going to therapy.
Yeah. People say, well, I'm praying about it. Well, prayer is good, but prayer and therapist also works.
Right. Better. Sometimes you need a professional.
Yes.
And so speaking of mental health,
absolutely.
I'm sorry, continue.
No, go ahead.
So I was going to say, speaking of mental health, how big of a role does food, movement, and sleep actually play in our long-term mental health?
Oh, sleep. You've got to get your rest. If you're only going on 4 or 5 hours, your brain doesn't have that time to reprocess and redevelop and get things going. So you need to get good sleep. You need to get good rest. And so we are often up late, rising early, or not paying attention to getting that rest that we need. Some people say, well, I'm okay with 5 hours of sleep, but are you really okay?
Right, because sometimes you see it on your face. You wake up, you have bags, you're tired, you're not as, energetic as you would normally be. So that's so true. Sometimes you might feel like you're getting enough rest, but in reality, you're going to crash by the end of the day.
Absolutely. So it's very important. And, when we think about the things we have to do, it's often difficult to say, okay, I'm going to put that for another time. because we tend to want to get things out of the way. And so there's always something else to do. But
That's so true.
Whether it's a 1 hour a week or 2 hours a week, you can decide, I'm going to spend this time just for me. Whether it's taking a long bath, whether it's putting some headphones on and blocking out the world and listening to your favorite podcast or music and just relaxing. Whether it's sitting in the park on a bench and just watching people go by. Oftentimes you need to have that period where your brain isn't working. Mm-hmm. It's absolutely doing it, which is the benefit. It's not being distracted by all the other things that you have in your mind, which is why when you're exercising, if you're listening to music or you're trying to do the exercises from the person who's conducting the class, that's what you're focused on, just that one thing.
It's true.
And everything else is gone.
I know. Self-care is very important, especially in today's climate. So before I let you go, I just have a few last questions. So how would you say our health needs shifting across would you say our health shifts across our 20s, 30s, and 40s? Like, what are some things women can do to ensure that they have longevity as far as their health or just extending their lifespan? Like, what are some things that change as your body develops?
Well, one of the things most people don't realize, in your 20s and 30s, you're moving, you can eat oftentimes what you want without gaining weight, and then your body's metabolism slows down. But it's also important to know your family history. What are your risk factors? What runs in your family? What are you predisposed to? Certainly, if your family many in your family have diabetes, you want to get checked early,
right? So
you can slow that down or even prevent it. High blood pressure, family history, then you should be starting your history screenings very early. Cancer, cervical cancer, breast cancer, you said before, make sure you're starting to get those we talked about mammograms, but get your pap smear. Want to screen for HPV at least, every 5 years, 3 to 5 years now is the recommended test. So you want to get your screenings. You want to get that blood work to say, what are my cholesterol? So even if and also going to the dentist, because dental caries and periodontal disease contributes to heart disease. So know your risk factors and get on board at least by the time if your last exam was 20 and you've gone through your 20s and not had an exam in 10 years, then it's time for you to visit the doctor and get some blood work.
Wow. Okay. Well, thank you, Dr. Scantlebury, for all of the tips and tricks you've given us on today's show. We are always happy to have you on the show. Is there anything that you want to tell our audience before you go? Can you tell us actually a little bit about the Delaware Health Equity Coalition and how they can, come to the office or sign up for an appointment or things of that nature?
Absolutely. The Delaware Health Equity Coalition was formed. It's a nonprofit, first of all, and we are a medical home, and we are located on 2100 Baynard Boulevard. And as of March, we have been, this is May. As of last month, we have over 1,200 patients.
Wow.
That Dr. Teal and I, as the primary physicians, have brought to our practice, and it continues to grow. And so we also have mental and behavioral health therapists in place. And so our goal is to be able to provide all those services that our patients need, keep you out of the emergency room and the urgent care, being able to really put that preventive twist to getting you checked on a regular basis, treating your diabetes, hypertension, seeing all the grandmas and the young kids. And so we are both adult and pediatric, all ages from 12 and up. Okay. And so we're definitely, our number is 302-394-6060. You can give us a call, or you can go to the website, DelawareHealthEquityCoalition.org, and put your information in so that we can get back to you to get you an appointment.
Thank you, Dr. Scantlebury. We really appreciate you.
Thank you so much. Have a wonderful day.
You too. Well, you guys
Take
heard
care.
it here first. Make sure you get your screenings early. Take care of yourself. Self-care is very important. And please check out Delaware Health Equity Coalition. They are wonderful doctors who treat everyone as human beings and hear you and see you. So that's all that we have for today on our first podcast episode of Every Woman. And we'll see you next time. Bye.